Hi everyone, Dr. Timothy Gallagher here again at Maragal Medical. This week we're going to be talking to you about treatment options for hip pain. At Maragal Medical, we're an integrated physical medicine clinic where we utilize a team approach. And our medical director, Dr. Michael Marciello, is going to be talking to you about the different types of hip pain, as well as a number of different causes of hip pain, so that you have a better understanding of what conservative treatment options are available for you. Take it away, Dr. Mike.
Talking about hip problems today. Well, what can come on with a hip joint and hip problems? We all point to our hip out to the side. We all think about, okay, my hip hurts. And we all tend to, even as a child, we all point to the side of our hip to say that's our hip. But when we think about the basic anatomy, when we think about medically what the hip joint is, we have to think about the broader picture of the anatomy. We have to think about what actually is happening in the hip joint. We know that we call it a ball and socket joint because there is motion with rotation, but there's a very strong ligamentous capsule that keeps the hip in certain positions, and we don't have as much movement of the hip as we do maybe of a shoulder that is also another ball and socket joint. But if we think about the hip and the attachments to the hip, which really is where we point, you have the tendons, the bursa, the muscles that attach to the side of the hip, but that ball and socket component in the mechanism is actually deep inside the hip joint or into the groin commonly. People who have a hip joint that might need surgery because it's become still so arthritic will actually start experiencing hip pain in the groin. So we want to really tease out the aspects when someone says, my groin hurts, we think about hip joints. If we think about pain to the side of the hip, we may think about hip or more commonly even back problems that refer down from the back into the hip joint. That actually is more common than actually seeing the ball and socket breakdown. However, we commonly will see arthritis in the hip, and as the body is walking or moving, because we weight bear through our legs and put pressure on our hip all the time, getting out of a chair, going up a set of stairs, there's a lot of forces that go across. Someone might teeter-totter when they're walking. We think about an arthritic hip that's resulting in the muscles weakened and therefore painful, and that takes away some of the pain. We think about difficulty lifting the hip to get up a set of stairs. Well, that could be a hip flexor, a muscle that lifts and flexes the hip. Our buttocks muscles in the backside actually extend the hip, so when we walk and propel ourselves forward, that can become strained. And of course, that's attached to our tailbone, our sacrum, and our lower back. So we have to think about all the different mechanics of which a hip pain may not be a hip joint problem. We decide that by examination. We'll get you here in the office here at Maragal Medical, and I have our chiropractors look at the motion of the pelvis. Myself will look at the mechanics of your hip, your back, and the nerves talking to those muscles into your leg all the way down to your foot. And our physical therapist will look at the ways we can strengthen you, standing on our robotics machine for balance exercises that will help control the center of gravity. But what's really the good ways to think about treating a hip joint problem is to really best decide if it's a hip arthritic problem, a hip muscle problem, or a referred hip pain that's coming from elsewhere, such as from your back. It's not that complicated when we start seeing these things regularly, but we want to make sure the diagnosis is correct for you. If you come to the clinic, we're going to say, hey, do we have anything that's going on at the knee? Hip joint pain is actually commonly referred to the knee. So if you're having knee pain, we can't exclude that you might have hip problems. And if you have arthritis in your knee or a flat foot, we want to give you the braces or an orthotic to get the alignment as best as possible to take some strain away from that hip. So here, we also think about ways we can treat it. The inflammatory aspects of arthritis or tendonitis, I'll commonly give you an anti-inflammatory medicine. We use some ibuprofen, but that should be a brief and short time. We look at the ways we can exercise through it, so we got to get the pain down. Well, if we can't give you the anti-inflammatory medicines for an extended time, what else could we do? Well, these newer technologies, as you've heard us talk before, platelet-rich plasma, which is a regenerative injection, could be injected around those muscles of the hip. Wonderful response for some of the microscopic or partial tears of those tendons that are attached to the hip that control the rotation of our hip muscle in our hip joint. Or we think about a regenerative injection into the joint itself. When you get the arthritis that is getting problematic, but you don't really need a hip replacement, you're in your mid-40s and have an injury back in the high school football days or just from your work, but you're too early, it's too young to get that hip repaired from a hip replacement. You can inject in the hip joint and actually get some motion back, restore the function by then allowing you to regain the strength of those muscles. So the ball and socket mechanism of a hip or even a shoulder really play a role in relation to the way the muscles work around that joint and the capsule and the ligaments structure of that joint for its integrity. Don't assume that you have pain in your hip when you're out to the side. Don't assume that you have a thigh muscle problem when it may be referred from your hip. That's one of those things when you're hurting from the hip pelvis down to your knee, through the buttocks, lower back. Give us a call. We'd like to help take a look at it with you because we may help get to that root cause of your problem, come up with the right diagnosis, get those diagnostic studies of your x-rays or MRI, and look at those other joints surrounding the hip joint to make sure we got the right choice before we start treating you. We're here to help. Give us a call. Maragal Medical will look at it as a team approach. We'll get you back on track. See you next week.
That was great information, Dr. Marciello. I think you all now have a better understanding of all the available treatment options when it comes to treating your hip pain. Here at Maragal Medical, we combine medical care, chiropractic treatment, physical therapy, all under one roof to make sure each and every patient gets the best care possible. And if you were ever offered a prescription medication or a cortisone injection to help with your hip pain, you're definitely going to want to look at more conservative options. Why would you use a destructive injection that's going to degrade the tissue where you can use a regenerative option to help repair the damage associated with arthritis or to help accelerate healing with partially torn tendons? If you like the information that you saw today, please subscribe to our YouTube channel. More information about our practice can be found on our website at maragalmedical.com. Folks, your health is your most valuable asset, and you should be able to access that asset each and every day without limitation. Let the doctors at Maragal Medical lead you on a path to wellness. Well, that's it for today. We'll see you all next week. Have a great day, everyone.